Have you ever showed up to the ER and waited multiple hours to be seen while people that came after you got seen before you and you couldn't understand why? Well, I'm an ER doctor. I'm going to take you behind the scenes and tell you exactly what's going on and what you don't see and why it takes so dang long to get seen in the emergency department. There are 5 main reasons that I think that emergency department wait times are so long, and I'm going to go through them here and break them down real quickly in a short video. So next time you're in the ER and you're waiting a long time and you get frustrated, you kind of understand what's going on to make it a little easier. The first and the biggest reason I think is because people that come to the ER think it's first come, first serve, but it's actually not. It's not first come, first serve at all. It's based on a triage system. So the sickest patients get seen first. If somebody comes in with chest pain, shortness of breath, stroke symptoms, they're going to get seen immediately. Or if they have uncontrolled bleeding, something like that. If somebody comes in with some minor pain or something kind of vague and they have good vital signs, they're probably going to wait a while to be seen. It's because the emergency department is truly for emergencies. I know that sometimes it's kind of hard to understand what's an emergency and what isn't, and people come to be seen, but that's why people are waiting more often than not. Number 2, there's actually a lot of hidden patients in the emergency department. When you come in, you usually come in through the waiting room and you see a fair amount of people waiting out there, but that's not everybody that's coming. There's a lot of ambulances that are bringing patients to the ER. There's police officers that are bringing patients to the ER. And if they're critically ill, they come through the back and you never actually get to see them, which can add to the frustration level. I think another thing that people forget to understand is that there is so much going on in the emergency department. When somebody comes in and they're not feeling well, we have to do a lot to try to figure out what's going on and to make sure there's not actually an emergency happening. So when that patient gets there, they get seen by the triage nurse and their vitals get taken. They get back to the room. There's usually only a handful of physicians and maybe even one in the emergency department that is seeing multiple patients at once. Once that physician sees the patient, they have to order blood tests. Sometimes they order imaging, and that all takes time to get done. Once that's done, the physician then has to actually interpret all of those results for each patient and kind of synthesize what they think is actually going on with the patient. One of the other biggest reasons that most people don't see and probably will never understand is something called boarding. When somebody's admitted to the hospital from the emergency department, they need to wait for a bed upstairs before they can move out of that room. If there's no available beds upstairs because there's too many patients admitted, they have to sit in the ER, and that's called boarding, and they take up that room. So another patient can't come back to that room. If there's too much boarding, this causes significant bottleneck in the hospital system, which kind of overloads the system and makes wait times significantly worse. Staffing is also a huge problem. There's only a certain amount of physicians, NPs, PAs, as well as nurses that can staff the emergency departments. This is especially true in rural America or in smaller towns. So when you come to the ER, there's only so many people that are there to take care of everyone, which is unfortunate, but it's actually just kind of the truth of the matter. We can only have so many people in the ER. So if it's a busy day and it's not staffed for such, the wait times are unfortunately going to be longer. My role as an emergency department physician is to make sure that everybody gets seen, but also to make sure that the sickest patients get seen and stabilized first. I've had instances in the past, unfortunately, where I've been doing active CPR and another patient barged into the room because they were frustrated with their wait time. So next time that you're in the emergency department, if you are waiting, that's probably a good sign and actually means that there's sicker patients than you in the ER at the moment. If you enjoy emergency medicine content or just medicine content in general, please like and subscribe.